uh, 3 ways first, 8 ways next, and now the 10 ways of diagnosis or diagnostic aid. This is by Charaka. And Charak was the father of medicine. So his approach was a little bit different. Okay. So Dashvid Pariksha, Dashvid means tenfold of examination. Maharshi Charaka insisted that a wise physician should investigate the following 10 points in sequence to avoid the mistake that are very, very harmful for the patient. So these 10 points are: number one is Dushya, body. He said, uh, check the body, have a look of the body, right? Examine the structural and functional abnormalities of the body to observe the body and the dosha level and if some weak part is there. So have a look if the person is limping or, it means just a structure or fat or very thin. Oh, okay, skin is not looking good. So have a structure, check a structural abnormality. Okay. He said, first to have a look on the body is very important. Number two, he said, check the location from where is he coming, from where, which country, which part of the world they are coming. So involves the analysis of the patient's geographical situation or the living place. At some places, there are some diseases which remain present, like infections or other problems according to the country and region. He said, you will you will face less problems if you can check from where they are coming, right? Unnecessary tests, unnecessary problems you can save. If I know this person is coming from Africa, so maybe yellow fever and all these, so from where are you coming, which country you are from? Oh, okay, let me first just separate you. This can be a yellow fever. Oh, malaria problem. Okay. Oh, that part is having dengue issue. Okay, please come. Let me just straightway check for the dengue, right? They say that in some parts of the world, some problems can be there. Oh, you are coming from any um, nuclear problem where happened. Oh, you are coming from there. Okay, let me just focus on that problem also, right? So he said that it's very important to understand the location from where they are coming. Next is physical strength. A person's physical strength is very, very important to understand, right? Because you will see many times that one person with the same problem, same kind of problem, same kind of severity will be like sitting quietly. No, I'm okay. Don't worry. Don't worry. I'm okay. And some person with the same problem and no, going to die, going to die. Right? So sometimes we have to use our mind also that you do not miss the serious patient, right? If somebody is because they are strong or their physical strength is good and they are not complaining too much, it does not mean that it's not severe, right? So you have to use your mind that who is having less um, strength or less capability to bear the problem can be very making very noise and creating like you are very, very sick, right? So that is also very important to know. Next is Kala, the season and climatic conditions. In army, it happens like people are boys are very, very strong, very strong. They do not complain. So we had one incident once that this boy came in his 20s, late 20s, and they just salute, standing straight. Yes, sir, I have a problem. Okay, what happened? Pain. Okay, 28 is the pain, like they are running like 13, 14 kilometers, and it was a special force. So in special force, they have to be very quick. Uh, so my husband asked him for a rest, you know, and within minutes he had a cardiac arrest, you know. So that also can happen that sometimes you are so strong that little problems you feel that I can be fine. No, this is about the physical strength. Some people can bear the pain or the problem very positively. They do not show that, or they do not feel that it can be serious. So we need to be very alert for all these things. All right. So this is the physical strength. Then is the calm or the season. Study the season and climatic conditions. This is very important that you need to know the what season it is. Right. If it is a season of um, mm, flu, so everybody who is coming with this, of course, my attention should be first for the flu, not straightway tuberculosis. Oh, you had a tuberculosis, no? This is a flu season. Everybody will be having runny nose and fever and coughing. So you need to be very aware of the season. Next is time, Agni. So how is your digestion? That is also very important. How is the Agni? Some people will be having very strong, very good digestion. Okay, so I need to note down that also. This is a very important part of Ayurvedic prescriptions that we need to be very careful about all these things. Digestion, we have to ask and check everybody because in Ayurveda we understand good digestion can solve many problems. Okay. So next is tridosha level. What is the vata pitta kapha situation in the body? Then is the age. Consider age of the patient. Tattvam, the mental status. Concern psychological strength of the uh, patient. Age is very important, you know. Yeah, you understand why? Why we need to know the age? Any idea? Yes, Mr. Prasad?
Because nowadays, many of them are doing the plastic surgeon, and they look very young, but it doesn't mean that they're really young.
Yeah. And also in certain age, some problems are normal. If
I guess it's
a
menopause.
40, 45 or 50-year old coming with the joint pain, okay, please, your bones are weak, so start some exercises. If a 10-year-old is coming with the joint pain, it can be very serious. It can be a rheumatic problem or a heart problem, right? So we just cannot say start doing some exercise, some pains, take a warm water bath, and start improving your structure. To a 50, 60-year-old, common body pains, joint pains, no problem. Just go home, relax, and make your body strong. But a 10, 15-year-old complaining of joint pains can be very serious. Age is very important. Okay. So same way is like coughing and chest pain in babies or young, normal. Kapha stage, always coughing and this problem. But in old people, complaining of pain and the coughing and all these things can be serious. We need to. So some age specific problems are there. That which is very common in this age, no problem. But same problem in certain ages, not good. So we need to be very sure of what is the age group. Okay. Next is Sattvam, mental status, as I told you, because psychological problems we can check by the sattva or the mental condition only. Many positive. This is especially I have seen in the cancer patients. A little bit positive approach and positive people will recover very quickly. More negativity, more negative, more you do not want to live anymore. So medicine will not help you much. I have seen this. Then many people just give up. They say, no, we really cannot handle it. So medicine will not be helpful, right? Some people have that zeal or that positivity for life. They want to still live. So medicine will be more helpful. So sattva or the mental status of the patient is very important. Satamya personal behavior. Satamya is um, like if I tell you that okay, you are not well, please have rest. But rest is so satamya to your body, you are always resting. You know, it doesn't matter to you. Now I'm saying please have rest. If I'm saying this thing to a physical hard worker person, please have rest. So it will make sense. A person who is having a very leisurely life, always resting, no hard work. So please rest. No, no matter. It does not matter, right? It will not help. So same way, like if you are having uh, a daily alcohol, right? And if you have a sleep issue or something, or this is not an example, that just giving an example of satamya. For some reason, I tell you that for 4 5 days, please take a 20 ml of alcohol. Yes, I'm taking daily half bottle, 20 ml. No, it is already satamya to your body, right? So I cannot prescribe that. You understand what I mean? Certain behavior is so much into your body that I I cannot help with you with that. If I say laborer, please do some hard work. No, it will not help, right? But if I say to a person who is having very leisurely life, do some hard work, do some body activity, it will help. You understand what does satamya mean? That your body is tuned to something that if I prescribe you, it will not help you. So I need to check whatever I am giving or whatever changes I'm making in your lifestyle, is it already satamya to you or not? If it is not, it will help you. If it is already satamya to your body, it will not help. You are already doing it, right? Okay. So next is ahara, food. So Acharya Charaka says very important to check what kind of diet they are taking. Okay. So make a note of the diet. If they are vegetarian, they are non-vegetarian, what kind of food they are eating, lots of junk or healthy food. So making a note on that diet is very important. Okay? Because there also you can find out lots of things which you can uh, change. So this is the 10 way of investigation by the Charaka. The practice of medicine or providing health is not only science, but it is an art. We have to collect a lot of information from the patient to reach to the diagnosis and other proper management to that condition. To reach the diagnosis is a science, but to collect the information is like an art. When I make a prescription for the patient, if Kazumi-san knows my prescription, so mostly I check pulse. I do not check for urine. We are not doing examination of stool also. Tongue I check, okay, and teeth and nails I check. Body we check. Country location we check. Bala I check. Kal season we check. Agni we check. Prakriti we check. Age we check. Mental status we check. So satamya we check. Diet we check. Right? And if there is a requirement for blood test, a stool test, and urine test, we prescribe. Give me a second. Hello.
あ、先生、声が聞こえ、I can't hear you.
Is it okay now?
Oh, yes, yes. Okay, now.
That was connected to my phone. Okay. So I was telling you that two type of examinations are very, very important when we talk to a person. Rog pariksha and rogi pariksha. Pariksha means examination, right? Rog means disease, problem. Rogi means person who is sick person. That is rogi, right? So he says, please have an understanding of both, not one. Only person is not important, and only disease is not important. You need to understand both the things. That how the disease goes, what kind of food, what kind of problems can increases, how many years it will go, or how many days it will go. Rogi person, what type of person he is, a kapha person, a woman, a baby, or an old, or a vata person, what kind of a person he is, right? So, Rogi Pariksha is mainly of three types: Darshana, Sparshana, and Varshana. By observation, by touch, by asking questions, you can understand about the person, right? And we have to understand the prakriti, sar, mental behavior, digestion, how is the bowel movement, how is the strength, right? Before starting the treatment, we need to know all these things. Okay. Then is rog pariksha. Rog pariksha is what kind of doshas are involved, dushyas are involved, ama is there or not, which system it will be affected, how many days it will go, what kind of medicine will help in this disease. So we need to know the disease treatment also, which stage it is going on. Exact knowledge of rogi and roga help the Vaidya to offer exact treatment to the patient. Vaidya has to be very keen in getting knowledge of the following facts: nadi, pulse, mutra, the micturition, mala, bowel, tongue, voice, sparsh, the texture, eyes, and stitcher. So these things are very, very important to note down. How is the pulse? How is the urine? How is the bowel movements? How is the tongue? How is the voice? Right? And if there is a problem, how is the texture? Right? If there is a problem in the skin, so what is the texture of the skin? Red, yellow, right? Or some secretions coming out. So this is the way of understanding the person and the problem according to Ayurveda before starting the treatment. Okay. So we will continue. This is like not very. The next important chapter is 21, Anupana. Okay, so I just stopped